Joining us now, House Budget Committee member, Texas Congressman Chip Roy. Congressman, great to see you. You've done your level best to try and pull back at least some of the awfulness of this runaway Democrat-created health care monstrosity. But to put it in perspective, this nation spends more than $111 billion on Obamacare subsidies in a year. And 1/4 of the recipients of those subsidies weren't even eligible for them. It is fraught with waste, fraud, and abuse. And Paragon Health Institute, Brian Blaze, you know who he is, they found that the Democrat government funding proposal would increase federal health care spending on non-citizens and illegal aliens by $200 billion. Democrats won't tell you that.
Dick and Jackie, great to be on. Obviously, I spent a lot of time during the big, beautiful bill. You and I talked about this a lot, trying to undo the damage of a broken Medicaid system that was made worse by the Obamacare expansion. Now you have this COVID-era subsidy that was put forward by Joe Biden, which is actually making the problem worse by driving up the cost of health care. And these subsidies are rife with fraud, like you said. And the issue here is that fraud is part of driving up the cost. But also what we have is the absurdity of having $400 billion of additional taxpayer subsidy that's what it would cost taxpayers over the next decade, over $40 billion a year. And you said it, Dagan, that goes into the hip pockets of insurance companies. Now, you may have noticed that in DC, New York, and places where politicians run on the Acela corridor, insurance companies are running a lot of ads. Now, it may surprise people to know the healthcare industry spends almost $750 million on lobbying Washington every year. That's 6 times more than the defense industry. Why? Because they want that free money. Now, you and I both know it's not free. It's actually now hitting the pockets of the average American family that under Obamacare is spending $25,000 a year for an insurance product that they can't even use, that they can't get the doctors of their choice, that have astronomical co-pays and co-insurance, and they have to spend a fortune. And look, I'm a cancer survivor, Dagan. I got into this public policy business running for Congress because I wanted healthcare freedom for the average American family so they could survive catastrophic conditions like I had to go fight and deal with. And this is not working. And Democrats are absolutely trying to make this a political issue because they have nothing else to run on. And Mike Johnson is correct, and the president is correct to tell them to pound sand. We need to stand firm for the average hardworking American, not the insurance companies.
But Congressman, those sound bites leading into you, I hope you heard them from some of the Democrats making the rounds. And what they're doing is telling the American people, we're fighting for you. The Republicans, They don't care. Your premiums are going to go up. They don't care. Well, I remind everybody, American Rescue Plan, Inflation Reduction Act, spending during the pandemic after the initial emergency. America didn't need to be rescued, and the Inflation Reduction Act actually increased inflation and was a green spending bill. So when you come full circle to the Affordable Care Act, which is unaffordable, they got subsidies during that time, as you mentioned, as an emergency, and they basically want to keep those in play forever. That's what people fail to understand.
Well, again, I go back to the fact that the insurance companies are spending $750 million lobbying to keep getting their subsidies from the federal government to enrich themselves and to make their stock prices go up. That's what's really going on. Democrats know this. They're trying to scare the American people. But you know what? I don't think the American people are buying it. They're getting tired of being sold a bill of goods where they're unable to go to the doctor of their choice. They're unable to afford even their insurance, much less their health care. We actually have solutions that would solve that problem. And President Trump, among the many victory laps that he should be taking, especially after we saw what happened in Israel this morning, he should be taking a victory lap over the things that he did when in his first term, and some of which he's extending now, like the short-term limited duration plans, right? Those got exempted from the Obamacare rules and requirements. So guess what? They're affordable. They're one of the few places you can go as an American to go get health coverage. There are health sharing ministries, the ability to have Medishare and all these other ways to distribute costs. Direct primary care is a fantastic way to have the doctor's cell phone number and get the care that you deserve. Health savings accounts, which should be massively expanded. By the way, we fought for that in the big, beautiful bill. We did get some good improvements in direct primary care, but we had to fight the Democrats tooth and nail, and a handful of Republicans who, you know who they are, who stood in the way. And now those same Republicans that stood in the way are the ones getting weak-kneed and starting to question, oh, we better not go down this road. We should stand up strong for the hardworking American family that's been getting screwed by a corporate cronyist system in Washington that is enriching insurance companies and is trying to give subsidies to people making over $500,000 a year, when we should actually fix our healthcare system with healthcare freedom. The first big bill I introduced in Washington in 2019 was the Healthcare Freedom Act, and it would do a lot of these things. We're making progress. And President Trump should take a victory lap and now fight for more of what he's already done to drive prices down. We should not give in to the demands of the Democrats, which are more about Washington cronyism than they are the American family.
Congressman Chip Roy, great to see you. Thank you so much. Dear sir, always.
God bless you, Dagan. God bless you.
God bless you.